So let us continue with Nash Therapeutics study streak. Normally, we are doing this session in the early evening hours, but due to some commitments, it was rescheduled. But nevertheless, so far we have finished almost 100, remedies from Nash Therapeutic Study Streak. And good to see Dr. Afjal Sayed, someone named as Hel Kunst, homeopath, and Dr. Pragati Tiwari, and many more who will be joining us. And also, some people are there on YouTube, so we are simultaneously live on both the platforms. And the remedies that we discussed last were from Nash Therapeutics, Chimaphila, Equisetum, Lepis alba. And what is interesting is that in Lepis alba, we saw that Dr. Nash had cured a very interesting case of uterine fibroid. We need to use this remedy more frequently in this way, in different conditions based on the analogy. So there is a unique post which we will be putting up very soon on the analogy. How can you understand the prescriptions while making prescriptions and while reassessing the follow-ups? But today we will try to stick to our topic, which is the next two remedies in line after Lepis alba, which is very also Medorinum and tuberculinum. So everyone has lot of information about the materia medica, about what Medorinum does, how Medorinum acts, and tuberculinum, etc., etc. But if you read Dr. Nash Therapeutics, you will get an interesting insight into how Dr. Nash, in spite of having very bare minimum knowledge of materia medica, barely any repertory in hand, how he prescribed remedies, and he has given beautiful cases across the book. And this is what the homeopath of 2025 needs to learn. When Dr. Nash had so less access to technology or zero access to technology, and he was only carrying one or few books in his library, he could cure so many good cases, and he has illustrated beautiful examples. He followed up with them, and in spite of having good access to technology and all the tools and all the books that we have, we are still struggling in curing patients. There are many issues with us, and one of them is that we are not understanding the analogy also of prescriptions, past histories, family histories, etc., etc. So good to see some people joining: Ruchi Saxena, Prashant Shinde, Vaishnavi Cheda, and a few others, someone named as Mandy Doc. We will discuss Medorinum and Tuberculinum from Leaders in Homeopathic Therapeutics by Dr. Nash. Without going into much materia medica knowledge, which lot of influencers are spreading all across, all homeopaths are spreading all across in the social media, we will try to focus on the cases from Nash Therapeutics, which Dr. Nash gives beautifully, illustrating how Medorinum, being known as a newer nosode in the early 1900s, he cured wonderful cases. One of the cases where he gave antimcrude as a remedy, and he was in, confident mood that antimcrude has helped some patients of chronic rheumatism. But this lady, which was a middle-aged lady, she must be around 30 or 40 years, was not able to attend the church few rods away from her distance. This is what Dr. Nash tells. And she had some troubles in her feet, ankles, and soles. And the feet, ankles, soles became so tender that she couldn't walk on them. Based on this analogy and this understanding, he gave antimcrude, but he failed. Next, what he did was medorinum CM potency, and the result was miraculous. So, if you are struggling in chronic rheumatism cases or patients who are having RA positive, HLA-B27 positive, you should think of giving medorinum as one of the top remedies. So, someone named as Homeopathophysio Action has joined, and it's very interesting that we are in an age where we have access to so many of tools from pathology point of view, from laboratory point of view, so we can have a good before and after understanding of patient with the reports and the patient recordings, and provide it to the old school practitioners for proof how medorinum is working in RA positive cases, HLA-B27 cases, and all the autoimmune problems. Next, what Dr. Nash tells us is another homeopath's case who similarly cured 60 years old gentleman of chronic rheumatism. And interesting, there was no history of previous gonorrhea in the case, which is what we see in the 2025 also. We don't check with the patient whether they have gonorrhea, their past ancestors had gonorrhea, somewhere in their life they had gonorrhea, but we just prescribe based upon symptom similarity. And Dr. Nash gives amples of examples where another case of caries of spine of long standing was cured by syphilinum by Dr. Skinner of England. Now, Dr. Nash also had similar patients of caries of bone and severe pain, and 3 doses of syphilinum CM potency were given, and the patient were cured in 40 days. So now, in this case, like in the previous medorinum case, there was no history of syphilis, there was no history of gonorrhea in that case, but the cures were done. So he puts a question in front of us whether we should believe in the no-sword theory, or it will just be homeopathically curative to cases not having the disease history. So it makes us ponder, and this is for the new age homeopath to investigate, prove, reprove, and hold that which is true. And I hope if homeopatho physio action is there in the Instagram live, and his team or her team would try to collect data from different homeopaths, or they are in the process. I am in the process, no doubt about it. And through Homeo Setu, the platform that we have developed on Instagram, YouTube, on various channels, we are trying to collect all the cases from different homeopaths, whether they are old or new, and we'll be putting up soon in the revolutionary tools in your hands, in mobile, in software, in web apps. So right now we have started with some video courses, and if you want to access video courses which have explanation from the clinical point of view, what to investigate, how to investigate, which remedy to give when, follow protocols, especially for renal calculi, calcaneal spur. I have given very good illustration of those things in the videos that we have posted. Anyone who wants access can go to our website www.homeosetu.com and get an access. If you want a special code for discount, do DM us. We will be able to provide it to you. So, going back to the topic, Dr. Nash, after curing a series of patients with nosode, medorinum, syphilinum, tuberculinum, he found that there is a good scope of nosodes to be prescribed in that age where it was new for him to understand about nosodes, and he got good results with syphilinum, with medorinum, if it was night and daytime modalities respectively. So next remedy which Dr. Nash tells, tuberculinum, and he gives a description of materia medica. I'm not focusing on the materia medica because we have access to all the tools we need to understand the materia medica, but I'm focusing on the cases because this is what the platform is designed for. This is what we should learn from different cases. How were they prescribed, why were they prescribed, what was the follow-up protocol which was undertaken by the homeopath. One case of retarded menstruation in a young girl for tuberculinum, what case Dr. Nash mentions is an eye opener. The patient was given pulsatilla twice, but after several months of intervals, there was no improvement. And since the sister of the patient had died of consumption, which is tuberculosis back then, which was called, Dr. Nash gave tuberculinum 1M and the case opened up. The patient grew well, had good menstruation subsequently, and good health. So, the past history and the family history, if you're not focusing on that, we are missing out on something. Just we are mindlessly interpreting mind symptoms or physical symptoms, but we are not curing the miasma of the patient, which is going to be a roadblock for your success. The next case which Dr. Nash gives us is where there was no money. Homeopaths probably struggled back then with money issues and now as well. And what is interesting is that some homeopath called in Dr. Nash, they discussed about Dr. Nash's leaders in homeopathic therapeutics, a previous edition, and told him that this case of hydrocephalus is not improving. Can you help? And what Dr. Nash did was that he saw the past history that there was tuberculosis. Tuberculinum 1M was given. Dr. Nash went away back to his town. He received a letter subsequently and he found that the head ceased to increase in size and it was the same. So this is the before after that we should get and give to the society back rather than theorizing like a sulfur element. The next case Dr. Nash gave was of a person having lung troubles from certain place in US, and the patient was getting worse and worse day by day. Dr. Nash gave sulfur CM potency 2 doses followed by tuberculinum CM. Now, throughout the Nash therapeutics, you will see that there is mention of CM potencies or 50M and extraordinary results from them. Maybe it's the collection of the best cases of Dr. Nash. He has not produced the cases where he gave 200 or 1M. 200 was a high potency for him. He has mentioned very clearly in many of the remedies, but he also jumped to CM potencies, which is an extraordinary leap from 1M and 200s. So this patient of lung trouble who came from certain place in US and was getting worse on allopathic treatment grew well on sulfur CM 2 doses and followed by tuberculinum, and the problem was located somewhere in the left upper lung. There was a distinct cavity. Next, and I think this is the last case which Dr. Nash discusses, and this is the case of chronic tuberculosis, and especially it is a case of chronic cough to be more specific. And Dr. Nash gives us how to manage this case beautifully. The patient's relatives, cousins, and brothers and sisters had died of tuberculosis. It was widespread in that age. The patient had gagging cough since 25 years. This is the only description we have. He had developed some chills. He got better by rush talks. Someone, Dr. Sheldon, was called in. He prescribed Varatramalbum without any effect based upon cold extremities, and the patient was growing very weak. But since the patient was not improving, Dr. Nash saw and he prescribed tuberculinum. And the patient, the first day, he slept without any cough as if he was under a sleeping pill. And he improved gradually. He visited his friend to certain other town. He came back. He developed a cold because of the weather in the US, which was cold. Aconite was given at that time, and then tuberculinum was repeated again. So this is the chronic case management which Dr. Nash illustrates in this case example in tuberculinum, leaders in homeopathic therapeutics. For tuberculinum, he recommends us to read very few lines from Allen's keynotes, which is symptoms ever changing, ailments affecting one organ, then another, the lungs, brain, kidney, liver, stomach, nervous affections, begin suddenly and cease suddenly. We often think of belladonna, we often think of colocynth, we often think of phytolacca in some respective conditions based upon their sphere of action. But tuberculinum is the general remedy which we should think of in such cases where there is rapidity of change of affections. And last case which Dr. Nash gives is a case of epileptic fits. The patient couldn't eat anything. There was an entire description of the case. Cannot walk properly. There is a lot of weakness. The last periods came to patient, but there was no good bleeding. There was diarrhea in the past 4 weeks and sweaty nights, and pulse was 100 to 120 all the time. Lost lot of weight and lot of soreness in the chest, cough mostly in the night. We always think and give small remedies to the patient. The prescription by Dr. Nash was also similarly a very short prescription, pulsatilla 200 followed by 110M, which did not help. Tuberculinum 1M was given, and for 4 months she was much better. Then it was changed to basilinum, and patient started improving. So all those cases where we are struggling with chronic upper respiratory and lower respiratory tract infections, we should think of these interesting nosodes. And Dr. Nash gives a very beautiful description of certain dates of the patient when he saw, how he prescribed what he prescribed, how he managed the case. It's a very small synopsis, but worthy of note for the homeopath of 2025. So I hope this gives you an insight and gives you the impetus to go through the basic books of our stalwarts, which is of which one of it is Nash Therapeutics, Leaders in Homeopathic Therapeutics by Dr. Nash, and keep following Homeosetu for some informative, educative, motivational homeopathic content which is going to transform your homeopathy, the way you practice and the way you see it. So, thank you for joining those who have joined, and stay tuned.